I remember going to a scene of an accident near my house, and I basically was helpless, couldn't help the person, so I wanted to find out more and find out what I could do to help.
I think the community is really a diverse community that is geographically spread out, and the importance of having a very strong, robust EMS system in Southern York County cannot be overemphasized given the long transport times to the nearest hospitals. Our experience has been that the folks in the community are very hardworking, and they only tend to call 911 and use us in their times of their most desperate need. We want to make sure that as a community partner, we're able to take care of them to the greatest extent until we can safely get that patient to the hospital.
We use simulation training. We found that it's one of the most effective ways to recreate the environment that our EMS providers face in the field. So we use mannequins, we use simulation equipment in order to give them the same effect that they would have if they were walking into a call. We find that's one of the best ways to prepare our people to actually handle the situations when they face them for real.
Some of the equipment that we felt that was especially important for our paramedics to have access to were video laryngoscopy, and we carry the King Vision to try and give the provider one more tool in their airway armamentarium to try and make sure that the airway is definitively managed early, and again, we believe it's especially important for that, that tool to be on board. Yeah, one of the things that we know really makes a huge impact on how well our patients do is how well the community is trained. We believe it's not only our mission to take care of patients in the back of the ambulance, but also to bring forward community education in the areas of CPR, stroke recognition, when to call 911, to make sure that the patient's receiving the best care that they can before we even get there. Again, our goal is to be there for the community, but we realize that given a large geographic area that we're covering, that the better equipped the bystander is, the better off the patient's going to be by the time we get there. Again, the better the patient's going to do in the end.
I think really what defines Southern York EMS though is not the equipment we have or the units, it's the people. We have a great combination of volunteers and career staff that work together to serve the community. Our career staff are chosen through a rigorous interview process, and we can honestly say that everyone that works for Southern York EMS, we chose to be here for their skill set.
I think there's nothing more rewarding than seeing the hours invested into training pay off with a successful patient outcome where the patient who otherwise might be deceased or disabled manages to come back and rejoin the community to the fullest extent that they were before they got sick.